Beyond Clean offers a creative look into the inner workings of the healthcare industry committed to getting it right every instrument, every time. Join us every week as we explore the hidden world of one of the most important aspects of safe surgical care. And now your hosts, Michael Matthews, Hank Balch, and Justin Poulin.
This week on Beyond Clean, we will be airing the first ever Beyond Clean panel discussion from the 2018 ISHM Annual Conference and Expo entitled Packaging Method Myth Busting. Our expert panelists for the event included Marcia Frieze from Case Medical, Joe Hannibal from Halyard Health, and Barbara Harmer from Innovative Sterilization Technologies. This is the second installment in a two-part release covering the second half of the panel event where things began heating up with a series of rapid-fire questions. And when we ended segment one, guys, we were talking about how the tension in the room and the anticipation was palpable. Everybody was on the edge of their seat, but then the pace really begins to kick up a notch with a lot of back and forth.
Yes, absolutely. I had multiple people come to me afterwards and talk about how they were literally sitting on the edges of their seats the entire time. People were just glued to this, and I would say that if that was the case in the warm-up section, then that was even more so the case in the second section.
That's right, guys. One of the primary objectives of this event, as you remember, was to get true to life questions out there in front of not only users, but also its multiple perspective panel to have everyone hear the same answers and give all of our experts the opportunity for a quick rebuttal. And we saw this in a wonderful way in this section with the rapid fire questions.
All right, well, we'll get right into it here. You can follow Beyond Clean on Twitter at Beyond Clean Info, Facebook.com/Beyond Clean Podcast, LinkedIn.com/company/Beyond Clean. Our Instagram is Beyond Clean Podcast, and if you'd like to share a picture anonymously, or if you've got a recommendation for a future topic or guest on the show, just send us an email to info@beyondclean.net. We'll be right back with part 2 of Beyond Clean's Packaging Method Myth Busting. Before we get started with the interview, Beyond Clean had an excellent turnout for our first ever panel discussion at the 2018 ISHM Annual Conference and Expo entitled Packaging Method Myth Busting, and want to thank the following sponsors for helping make the event possible. Northfield Medical. The new Northfield is focused on hospital operating room device repair management. With millions of medical device repairs a year, they help hospitals make data-empowered decisions on capital purchases, sterile processing procedures, and staffing. They provide surgical and diagnostic equipment repairs that meet OEM standards and consultation on repair trends, true program cost, and measurement baselines that improve outcomes and supply chain efficiencies. Ascendco Health, your data, cleansed completely, organized intelligently, and visualized brilliantly. Ascendco is an emerging health tech company changing the conversation, enabling sterile processing to achieve and sustain peak performance. Take your first step and contact co-founder and CEO Brian Reed. The team at Beyond Clean is very big on data and analytics, and Ascendco is doing some amazing things. I would encourage you to learn more. LogicQuip. LogicQuip provides hospital-grade storage equipment to any department in the hospital and specializing in CAD design, space utilization, and inventory optimization. Ready Set Surgical automates the surgical vendor supply chain. Their cloud-based coordination platform consolidates logistics and communication for all members of the surgical team to ensure that every patient has the right equipment with complete documentation at the right time. And finally, Ultra Clean Systems, Inc., born out of a need to provide healthcare facilities with better, more reliable ultrasonic cleaners for their sterile processing departments. Ultra Clean has been leading the industry with efficient designs that provide the most throughput while enhancing patient safety. Ultra Clean also produces Newsflash, a weekly digital newsletter covering a variety of interesting topics relating to sterile processing and infection control, plus new emerging and medical technology. technology, as well as links to ISHM state chapter events and CEU courses. Newsflash also offers a feature article every other week with none other than Hank Balch called The Front Line. Please subscribe to this unique newsletter. Register at ultracleansystems.com under the Newsflash tab. It's free.
Moving now to our section of rapid fire questions. This first one starts off with Joe. Does your packaging method save facilities money as compared to the alternatives?
Yes. No, but can we have a... Can we...
60 seconds.
Okay. Can we have an actual conversation about what it really costs to use all these products, a true total cost of ownership view? So often we look at either operational expenditures or capital expenditures or one department's budget rather than a holistic picture. We have to stop compartmentalizing the spend and get a true sense of what it actually costs to use the product. We also can't make these purchases in a vacuum. There is downstream impact. With containers, we must look at the acquisition cost, which can average $600 for the commonly used size, a little bit more for some of the one-tray products. We must also look at repair costs. We must look at replacement costs. Facilities can spend thousands of dollars and not increase their net container inventory because of the year-over-year retirement of non-working or non-functioning containers. We have to ask ourselves, can our departments absorb purchasing another washer? Can we hire another FTE to not lose precious throughput? These are downstream impacts. In the case of one tray, consumables, $15, can we really absorb that at scale?
The next to Barbara.
Well, Joe, I'll pick up on your last comment. I don't know that you can afford $15, but if you use enough of them, I'm sure you won't be paying $15 for a filter.
You're going to cut me a deal?
But savings can best be described in an organization, dollars in purchasing redundant instrumentation. Because one tray can rapidly turn over instrumentation, we are also saving you in utilities. The dry time, eliminating the dry time, what most individuals do not understand, that in a sterilizer, there is water consumption during that 30 to 40 minutes of dry time. And so we're able to save you that as well as electricity. Less disposables as compared to wrap. More productive staff because there's greater efficiencies, not waiting around for dry and cool time. We've already answered the question. You can repair and replace as many times as you need to with a lifetime warranty, and there could be even a decrease in overtime so that you don't have two levels of staff, the OR as well as central, waiting around for trays to be finished.
To Marcia.
Okay. There's no question that most containers save money over wrap. Our Steritide container saves more money than any other container on the market because, first of all, it's universal. That means you can use it for any method of sterilization. We're also cleared for internal and external stacking, which reduces your container inventory. Furthermore, with the compatibility of low temperature and steam sterilization, the one model serves all of your needs irrespective of what type of sterilization method you're using and also what type of device you're placing within it. Our return on investment is very short, and the lifetime of our container is very long. We have customers that have our containers now for nearly 18 to 20 years, and they're still functioning as new. Again, you must use a pH-neutral detergent to keep them clean. And most importantly, we offer a modular system of instrument trays and components to protect your devices during transport and storage. And that alone saves you a lot of money. And I'm just going to reiterate, the cost for our disposables is 50 cents maximum per use.
Right,
a tremendous cost savings over wrap and certainly over the other product that's being discussed today.
The first rebuttal goes to Joe for 30 seconds.
So I think it's really important to understand what we're spending to use these products, right? Repairs are often a black hole. How much are we paying to do that? The consumables do exist. They are less than wrap, but the acquisition cost is higher. This is something where if we're being true stewards of our business, we have to understand what we're spending across departments and across budgets. And frankly, if the product isn't performing as clinically intended, we have a bigger problem to answer. You can't put a price on patient safety.
To Barbara.
So I totally agree with what Joe just said. The cost standard has too many intangibles in it currently. If you ask what the true cost is, most facilities would not have a clue. Facilities don't know even how much it would cost to reprocess a tray. The literature says it's approximately $44 a tray to reprocess. But until industry becomes the cost standard, there are too many intangible factors. And we talked about financial incentives and initiatives, but we lack the ability to figure it out.
To Marcia for 30 seconds.
I think there's no question that containers save money over wrap, but there are containers like ours that are universal, highly durable, have a very tight seal, have clamping action, have filter retention plates that don't fall off, have a tortuous path built into the design so that microorganisms that are not smart enough to turn corners and go through a maze are left out of the product. So there are differences, and also the whole idea of maintaining the product, washing it, keeping it clean, inspecting is important.
Thank you, panelists. The next question, we're going to follow the same order and the same times. So first question will go, the first response will go to Joe again. The question is, what environmental concerns does your perspective address? 60 seconds.
Thanks, Mike. So before we dive into this, I think it's really important to dimension the actual problem. Healthcare waste makes up less than 1% of all municipal waste. 1%. So that said, specific to wrap, we have decreased our environmental footprint with programs such as Blue Renew, which allows facilities to recycle their clean, used wrap and keep it out of landfill. Since 2008, that program has kept 18 million pounds wrap out of landfill and freed up 270,000 cubic yards of space. So in other words, think 55 million milk gallon jugs taken out of landfill. That's what that program has done. Bluecon resin is another new innovation which extends the life cycle of wrap by turning it into basins, totes, really anything plastic. When we consider the resources needed to reprocess containers, healthcare design tells us it takes 570 gallons of water per bed per day is in use in healthcare facilities. We have to think about both sides of the ledger. As a manufacturer of single-use products, we have mitigated our impact. Can the panel say the same?
Same question to Barbara, 60 seconds.
With the elimination of dry time with a one tray, we have a greener product. We use less energy. There's less trash as compared to wrap. We've proven that there is savings of gallons of water, as I've already mentioned, by eliminating the dry time. One particular facility put a meter on their sterilizer and was able to prove that in 3 loads they saved 180 gallons of water. It's almost impossible to quantify environmental concerns when cost mechanisms and structures don't exist in the industry to make these comparisons. We can verbalize what we think, but until a majority of healthcare systems and organizations can quantify their expenditures, it's impossible to answer this question with an objective answer.
Thank you. Next question to Marcia.
Consider that containers are reusable and metals are recyclable. Compare that with wrap, which is a disposable. It's a disposable that is not biodegradable. Furthermore, Case Medical is a sustainable manufacturer. Everything that we do is based on keeping our environment, keeping our world safe. We're a Safer Choice Partner of the Year. We meet the requirements of the Chemical Footprint Project. We endorse the use of reusable containers, but I am very concerned about containers where we are stating that there's no need to dry them. And I don't understand the idea of millions of tons or whatever of water to dry a container. Drying is the elimination of moisture. And I just want to comment that how do you know that a container, or even an instrument set, was properly cleaned or decontaminated beforehand? Also, that sterilization is a statistical concept. And in both cases, one, it's not safe because it hasn't been dried. In the other, it's not a renewable product.
Thank you. Now will be time for rebuttals. First rebuttal will go to Joe. 30 seconds.
Thanks. So I do want to agree with Barbara. We need to establish a universal bioburden index. Attempts have been made before looking at reusable fabrics versus disposable and actually showed disposable fabrics are friendlier on the environment. We need to further that research. As far as I was under the impression we're representing the medium as a whole, but from a manufacturing standpoint, Halyard keeps 99.7% of our stuff out of landfill from our manufacturing sites. So we also are very green and continue to be that way and strive for more.
Thank you. 30-second rebuttal from Barbara.
I think I'll just reiterate what I've already said, and that is until we develop a standardized mechanism to look at how we are spending our money, how we are basing the cost structure in our facilities, and come up with some kind of a system to approach this, we're just shooting pie-in-the-sky numbers out there.
Thank you. 30-second rebuttal from Marcia.
First of all, if anyone is interested, please contact me tomorrow or the next day. We'll do an ROI. We'll show you how we'll save a tremendous amount of money going to a reusable container that's durable and sustainable, of how you can process product quicker. We have a pending 510K for a 5 to 8 minute dry time. I do believe that dry is safe for patients. And as I said in my little bio, I'd rather lose a customer than lose a patient. I can sleep at night because my containers are dry.
All right, thank you. I know it will surprise the room to know we're nearing the end of this discussion already. The time has flown by, but we have a final question, and then we'll move toward the summary statements. This will start first for Joe. What is the biggest unanswered question that has come up during tonight's panel discussion?
So if I was a CS manager or a clinician responsible for patient outcomes, I'd have 3 questions. How do I ensure that I'm getting a reliable seal over time with my rigid containers? 2, how do I do proper visible checks that represent the efficacy of the product? And 3, how do I reconcile the true burden of ownership? Containers cost more than you think from a financial, from an environmental, and from an efficiency standpoint, and I think we need to have a good, rational conversation about that. All things considered, wrap is the superior packaging method, and clinically speaking, we've discussed 4 different studies that would suggest that.
To Barbara for 60 seconds.
Thank you. We've got many practices that we've bought into over the years, but yet there's little to no scientific evidence. There are many contradictory statements in the industry. Evidence of this lack of certainty is the use of should, would, can, may. Must is rarely used, yet we tell users to follow the manufacturer's instructions. Why is this a should statement as opposed to a must statement? There's a lot of confusion in the field. Many practices are not supported by scientific evidence, and guidance is not up to date with current technologies. Just ask those of us that sit at AAMI ST79, how many years did it take for the new edition to be printed? Updates occur over a span of years. Think about it. Apple can send off updates routinely for our phones.
All right, to Marcia for 60 seconds.
Of course, technology is changing, but so is scientific data and empirical information. There are studies that have been done for marketing purposes. The one that Joe is talking about, we can go through and talk about how some of the bacteria or the spores that were used can go right through his own filter. We can also talk about the way that wrap costs money because it's a continued expense. It's not a reusable expense. You even have to pay for disposal of it. And I think one needs to look at the quality of the packaging material itself. But I think the biggest unanswered question tonight is it's safe to use wet loads for future use. Clearly, what does a wet load mean? And why do some folks feel that it's safe for storage? And don't you realize when assessing risk that dry is safer than wet?
The first rebuttal goes to Joe for 30 seconds.
Thanks. So Barbara had mentioned lack of scientific evidence. I would actually counter again. We talked about 4 studies, of which only 1 were sponsored by Halyard, the ARA study. The Dunkelberg study was not peer-reviewed. AGIC, the Cavan study was not. The Lambert study was not. As far as recycling, just to level set, you don't have to pay for that. That's something that we are able to facilitate. And the bacteria going through the filter, we can have that conversation, but that's wrapped past that test as well. Thank you.
And to Barbara for 30 seconds.
Well, let's talk about wet packs. So as I've mentioned already this evening, there's limited evidence. Limited evidence doesn't give you much to hang your hat on that there's a problem with it for a microbial path. However, if you look at AORN and you look at AMI, both current documents, they're contradictory statements. For example, limited evidence, yet in another section, AORN tells the user to develop policies and procedures for rigid containers with retained moisture. Which statement do you agree with? Same thing with multiple references in ST79. Annex H, which has now been created. Read what Annex H says, which is listed as informative.
Thank you. And to Marcia for 30 seconds.
Okay, I'm going to make this one really quickly. You mentioned the CDC. What does the CDC say about when sterile items open to the air, they will become contaminated? Thus, there is a longer risk the longer that item is exposed to the air. And when there's moisture is a wick for the growth of microorganisms. So, yes, my container is sterile when if there's any moisture inside. I just think that the safety issue pertains to what about the devices that you're putting on the back table? What is the issues related to when you open the container itself in a hospital environment, which is a community of ill people? Contamination.
Thank you, panelists. We've entered the final phase of our discussion. We will now allow 3 minutes to each panelist for summary statements, and we're going to go in reverse order from how we opened. So the first 3-minute segment goes to Barbara.
ASCs and hospitals have long struggled with the problem of providing one standard of care to each and every patient. With increasing surgical volumes, healthcare organizations have an increasingly difficult time meeting the demands of medical device sterilization. Historically, it was customary for instrument trays that had been previously terminally sterilized to be reused again later in the day for other patients by subjecting them to immediate use steam sterilization. In 2006, the one-tray sealed sterilization container was cleared by the FDA to be used to hold temperature-tolerant medical devices during steam sterilization cycles and then be stored. Another rigid container system? Hardly. Not at all. Packaging systems had a breakthrough in technology, not since the 70s. The development of a scientifically engineered product that moves steam better through the container to the hardest areas in a rigid container system was a significant advancement. The design of the tray increases airflow volumes, allowing steam to quickly reach the lateral edges of the tray. Unique only to a one tray in the healthcare marketplace, the FDA cleared this packaging system with no dry time, no cool time, and storage. Staff can now react to changes quickly during the day schedule or addressing on-call situations when dealing with emergent needs. I'm surprised by some of Marcia's comments this evening because Marcia and I have already debated this at an open public session at AMI ST79. And I'm here to tell you that AMI ST79 certainly did not change its position. It cannot go against what the FDA has cleared. Although opinions are worthwhile, they are not objective and they're not based in reality when it comes to clearance documents. Reduction of purchasing redundant instrumentation is realized when using one tray due to the ability to turn trays quicker. Replacing of older equipment at the end of its useful life can also be decreased as the inventory may now be enough when using one tray. Do not allow wrapped trays or other containers with required dry and cool times, insufficient instrumentation, late arriving vendor trays, additional surgical volume to interfere with the surgical schedule. One tray is the solution to keep your surgical schedule running smoothly. One tray's economic gain comes from the elimination of dry and cool time. The newest advancement in rigid container technology, and it's a major integral addition to many successful and safe quality surgical programs. Organizations have a choice. Choose one standard of care for each and every one of your patients.
Thank you. 3 minutes to Joe.
Thanks. First, I want to thank the Beyond Clean team. Sincerely, it's an honor for you guys to have invited me here, and also the panel. Thank you, Marcia and Barbara. Nice job. Managed not to hurt each other with our retractors. So we talked about talked about three things tonight. One, the lack of having reliable seal with containers. 2, the lack of breach identification. And 3, coming to terms with the true burden of ownership. As new science becomes available, we must take advantage of it. Let's not let the regulatory hammer of Joint Commission or the FDA drop. Let's not wait for something like this to appear on the cover of USA Today. I think we can all agree that our number one main goal is to get a sterile tray to the OR 100% of the time. When science becomes available that lets us know the status quo is no longer dependable or reliable, and new technology offers new options, we should run, not walk, to explore those. There's no reliable way to identify a breach in a container, period. I think it's also time to come to terms with the true burden of ownership. Financially speaking, I would challenge us to break outside of our silos, departmental, and budgets, and really look at the true cost of ownership with these products. Are we thinking about buying another washer? Are we thinking about hiring another FTE? Are we thinking about the replacement and the repair cost? We fully acknowledge the reality that many of you probably use some mix of wrap and containers in your facility, so we encourage you to continue the dialogue, encourage your peers to continue the dialogue, go back to your facility, and challenge the status quo. All things considered, wrap remains the superior packaging system. I would once again like to thank the Beyond Clean team and the panel of guests here tonight. Thank you.
Thank you. 3 minutes to Marcia.
At the end of the day, we're not talking about packaging. We're talking about patient safety. We're talking about the fact that it's important for those of you that are considering a packaging method to make a risk assessment on which is safer for your patients. And when it comes to sealed containers, there's no question that sealed containers are virtually impenetrable. A breach of wrap is easy. The tears in the wrap or the punctures, we all know about them. They're easy to find. The other thing is, when you think about it, if our goal is truly patient safety and welfare, you want to use the products with the least risk and the best track record available. Everything else is just marketing. The words, the statements, even some of the studies that were set up, not as a scientific study, but to make a point. And it was interesting, I was listening last night to Amanda Carpenter talking about her new book called Gaslighting, and I got really curious. What does gaslighting mean? It's a form of manipulation that seeks to sow seeds of doubt and distrust in a group, to question even their sanity. Come on, guys. Everybody here knows that a dry outcome is safer than a wet outcome.
Thank you. Thank you, panelists. Justin?
Well, I personally am really impressed with the preparation of the panelists, and I want to make sure we give them a round of applause. They're brave to come up here all at once today. I think Joe was trying to win some points, throwing some thanks to us. Thank you, Joe.
This is scored, okay.
Yeah, we didn't score it, but, you know. So I do want to say at the very beginning, we talked about learning and listening from each other, and that was really the whole point of bringing this panel discussion together. That was the second installment in a two-part release covering the second half of our panel discussion event from the 2018 ISHM Annual Conference and Expo entitled Packaging Method Myth Busting. And things were definitely at a much faster pace in the second half. A lot of back and forth between the panelists. And after the event was over, nobody can really hear this on the podcast, but many people stuck around. The discussion continued, and we did get some feedback about offering the audience an opportunity to ask questions to the panel. And I will say that if we do this again next year, and that's our plan, that we will create an opportunity where people can submit questions for the panelists via their smartphones, and then we'll be able to pull out some key questions to put up to the panel. But good feedback and great discussion following the event, and really pleased with the turnout.
That's right, Justin. We've actually gotten a number of responses through an after-event survey, and as you said, a lot of fantastic response. I've seen folks say things like, great topic, current practices need to be challenged. Excellent, great work. We're looking forward to future events. Everyone, we just ended our first ever live event, and then everyone was like, when is this going to happen again, and where's it going to be, and can we get Beyond Clean on the road? And, as we have talked about in the background, that's definitely something that's on the radar for us, because we know, just like with the podcast, these are questions and topics that are really buzzing in the industry. And we've got the awesome opportunity to bring experts together and make conversations like these happen. So it was a fantastic time in Phoenix, and I cannot wait to see what's going to happen next.
Yeah, absolutely. And for those of you who didn't go to the conference, the show was on Tuesday night. That's the final night of the conference. And I feel very confident in saying that the Beyond Clean event was what so many people were talking about during their last night of the conference dinners. We know this because when we went to dinner after the event, we walked by several tables and we saw people who were talking about the event. It was the thing that people were buzzing about the most. And so everything just came together wonderfully. Again, we really just want to thank our panelists and all the people who were there. It was really an amazing time, and I can't wait to do it again.
Yeah, absolutely. And as you've listened to the two-part series, you've heard advertisements from sponsors who helped make the event possible. Can't thank them enough for helping us put this together. That's going to do it for this week's show. As a reminder, you can help support us by subscribing to Beyond Clean on iTunes and Stitcher. We'd appreciate a rating and a review because your feedback is important to the show. And if you have any topics that you'd like us to cover on a future episode, or if you'd like to share a picture anonymously on our Instagram page, just send an email to info@beyondclean.net. On behalf of Hank, Mike, and myself, thank you for listening to another edition of Beyond Clean.